Welcome to the Principles of Medical Device Design and Innovation. And this introduction is really just to sort of lay out the road ahead. And in the next couple of minutes, what we're going to do is kind of walk through 6 major areas that are important to this course. Some introductions are useful because that really does help set the context of this particular course relative to biodesign, as many people know it. And that, of course, includes a little bit of history. What we'd like to also do is talk about what we'd want to accomplish in the next 14 weeks. And I'm going to come back to this idea of context. The context of biodesign and innovation is very, very important. And we'll, of course, throughout the course, reflect numerous times on the Stanford approach to the context of design, because that's what fundamentally differentiates it from classic design, as many people know from their undergraduate engineering course. Central to this is this introduction to needs analysis and specifications. And I'm going to emphasize needs analysis because often this is the area that is taken very lightly, and there's a shortcut to that in conventional design. And of course, we'll touch real quickly on potential projects. So that's really what we're going to cover in the next couple minutes. If you had to think about the simplest way to characterize the biodesign strategy for innovation and product design, it's identify, invent, and implement. And again, going back to what I said about a minute ago regarding the process on the needs analysis, really it's about identifying what the true need is. Many people who take this course sometimes get a little frustrated because they're like, we've talked about need over and over and over again, and as an engineer, what I want to do is get on with the invent, and I've got on and move on to the implement. But basically, what's been proven over the last 2 decades is that if you shortcut the identification part of the proper need, then really the invent and implement result in a lot of wasted time. So this is a strategy that's a little unusual relative to classic design. The idea of ideation, innovation, entrepreneurship, I think we hear these words quite a bit, and I just want to touch real quickly on the differentiation between them. This idea of ideation and invention is the process of generating ideas to solve a problem, and I think most engineers would relate to this. But the question I'm going to pose to you is, what is the true problem? Many times people will say things like, well, it's pretty easy. Just ask the customer what they want, and then that will define the problem. And in fact, we'll find that's not the case for the biodesign process. So ideation and innovation, this is something that, of course, is very popular with a lot of the new approaches to device design and startups and things like that. Innovation really is the process of arriving at a new solution to a need. And I'm going to underscore need here. So in this particular course, when we talk about innovation in medical device development, we are, of course, once again, going to be focusing heavily on what the need is. And entrepreneurship, in my mind, is really nothing more than the practice of delivering a new solution to the market. Remember, it doesn't have to be a new patent. It doesn't have to be some fantastic genius. It's just a new solution to a need in the market. A lot of times people say, well, you can't, the discipline of innovation, I don't know, it's sort of luck, it's a sort of creative genius, and we have enough examples where people who this eureka approach to innovation, whether it's the Goodyear approach to, vulcanized rubber, or, the Great Batch's insight in cardiac devices. There's no question that statistically there are going to be innovations that are a consequence of the eureka moment. But in fact, I think what we'll find is that the discipline of innovation and strategy actually can be a learned, acquired process. And this is why we use the book Biodesign out of Stanford, because it does translate what's required for innovation into very understandable, easy steps that just about everybody can accomplish. So it doesn't require you to be a workaholic genius or anything else related to the myth of an entrepreneur. Again, to underscore this approach that I've been mentioned, it's a structured approach to innovation. Again, does not require the unique eureka moment, does not require a genius, does not require workaholic. Actually, if you look at successful entrepreneurs, very few of them actually match the myth that seems to prevail. So again, you see in this structured innovation process, what's at the beginning? Yep, the unmet clinical need, and then that translates into a challenge. So some of the things we're going to be doing is we're going to be looking at the need specification and the need assessment. So really the very first third of the course is going to be structured on this left-hand side, where we're really just going to be focused on the need assessment. So hang on to your hats, because this is something we're going to go through. But what usually happens is when people go through the process, then they're like, wow, I had no idea that the problem as I formulated it was so fundamentally different than what a knee-jerk reaction would have been had I just simply asked the customer. So basically, the Stanford process, again, is the identify, event, and implement. They did a wonderful job in taking, again, what people thought was sort of a magical a process with a lot of mystique, and translating it into actionable terms. Again, identification means need finding, need screening, and then selection and specification development. Specification development is very important, and many people are familiar with that. Brainstorming, don't need too much to talk about that. I think many people are familiar with that, but we will go back to some of the concept, screening, and selection that you probably have experienced in your senior design classes. Implement, again, take this all the way to market. In this particular class, we're not too concerned about the implementation process, but we are going to touch on it because it is quite central to the whole biodesign process. Again, I want to translate the three phases into more specific modules, and these will be the modules for the class. Again, the identification here, we're talking about the introduction. Certainly in the next day or two, week or two, we'll be focusing about need statements. We'll talk a little bit about how we're going to accomplish clinical validation in this course. Then, of course, we move on to the invent portion and then the implement. And there's a couple different options for learning about these things, but we're going to try to touch on all of them so that we actually have a well-rounded program. So course structure, again, we're going to try immersion as best as we can for distance learning. But what we're going to talk about a little bit to begin with is context. And the context of the course is very, very important. Then we're going to look at some of the needs analysis, market analysis, and stakeholder analysis. And of course, we need to know a little bit about the disease or the condition. And then all of this is going to sort of culminate in the next couple of weeks in what we call the needs statement. So the document of the needs statement is going to be the focus of next week's activity. And we'd like to sort of wrap up with comments on business strategy and finance as we move forward. Thank you very much.